Gareth, now you may soon exactly know which foods are high in salt, sugar, fat and have artificial sweeteners. The Health Department has gazetted new draft regulations for labelling and advertising on foodstuffs. And the public has until the 21st of July this year to comment. For more on this, we're joined by Nzama Mbalati from the Healthy Living Alliance. Nzama, thank you so much for your time. Just in terms of the regulations that are required for food labelling, can you just talk us through what consumers need to know?
So basically, the regulation is part of the framework that the government, and which we support as civil society, is trying to reimagine and regulate the food environment. The food environment that we are in is actually dominated by highly processed food, the food that is actually unhealthy, and the problematic ingredients in the main that are problematic is the salt, is the trans fat, and the sugar. So the regulation is trying to easily depict that for consumers when they purchase food at the first glance through what we call the front of pack warning labels. All packaged food that will have a higher threshold as per milligrams in the foodstuff will be actually marked as high in sugar, high in salt, high in fat, making it easier for consumers to understand this is actually an unhealthy product that actually can endanger my health.
But as you were saying, that healthy food products are probably specialized, that you'll get at niche outlets as opposed to your regular supermarket. Are we likely to see a different look and feel of the products? In other words, like sin products will have high content of alcohol, for example, or tobacco products. Is this also going to affect other consumables?
At this present moment, I think because there is a definite regulatory framework for things like alcohol and tobacco, they are not most likely going to be included in this regulation. This will have to do with foodstuff, but included in that will include things like fruit juice and sugar-sweetened beverages, amongst other things on the package of food, so food and beverages. So I think the main thing here, what I think also is important, Cindy, is to actually encourage consumers, actually raise awareness to consumers, because currently what we're eating, we are not aware of what we're eating. So at the back of the package, ingredients is written in the nutrition language that many of us cannot understand. For example, many people do not know that sodium is salt. So it will be easier for consumers to depict products that are unhealthy. So, and it's very important as a country to start defining what's unhealthy food, because we have not done that in the past. And the awareness around the risk associated with unhealthy food, the knowledge levels in community is very low, and you have seen with tobacco, when awareness came in, it came in with regulation. With many people who even smoke, they know the risk associated with smoking.
All right, let's talk about consumer participation. Sorry to interrupt you. Just in the interest of time, we say until the 21st of July, but these activities usually happen when you have access to internet or information as well. At grassroots level or low-income areas, we often miss that particular cohort of the population.
It's very important, the point you have raised. So what is the policy without people? So we are actually going down into communities. We're going into 38 districts in 8 provinces, at the community level, sub-district level, at schools and at community halls, at churches, actually engaging communities on this very important regulation so that people are aware and people are participating. We also have digital groups on WhatsApp where we have already pre-packaged what we are proposing as experts in the field, in terms of where people can easily click, and in a very simplified way people can be able to make input. So we are actually going around the country to make sure that this information reaches people and people can have their say on the regulation.
And what's going to happen in the informal, often very unregulated space in the townships where we've heard of illegal food products or even foods that have been manipulated? About my friend, typically in the tuck shops, how will this then affect their operations and ensure that there is food safety in communities?
think it's a very important question, and often in communities where we've already started with 5 districts in Gauteng. In the communities, people are actually raising that because in the bulk of the time, people buy food at the spaza shops and tech shops. So we hope this regulation will be able to improve the monitoring and enforcement of food safety. Of food regulation in the supermarkets, in the tech shop where people are buying food, and we're hoping that the National Department of Health will be getting the message back, because we are documenting what people are raising as a broader concern on food safety and actual access to nutritious food in terms of where people purchase food.
Really appreciate it. Thank you so much for your time. We're speaking to Nzama Mbalati from the Healthy Living Alliance, where you can participate in the government gazetted regulation around food safety. You have until the 21st of July.